Hi there. Today I'd like to go through 3 myths about addiction because I hope through listening to this video you might see how these myths might be impacting your treatment and discover the reality so that you can begin your journey towards recovery in a healthy way. Myth number 1 is that if you use any of these substances regularly, they are naturally addictive and anyone who used it would become addicted. Studies have repeatedly shown that merely using an addictive substance for an extended period of time does not automatically cause addiction. Otherwise, every person who's ever been for surgery and has been prescribed painkillers would become an addict. But we frequently see people who have taken these medications and then who are able to subsequently stop. Also, as Gabor Mate has pointed out, many things can become addictions that are not substances, but are instead behaviors, such as shopping or gambling. Finally, if it were merely about the substance, all it would take would be to weather through the withdrawal period, and then we would never desire to use again. Since it is not the substance that impacts your addiction, it is more important to understand the purpose of the addiction so that you can find the behavior that's going to serve you better. Myth number 2 is if you are struggling with an addiction, you need to attend an inpatient program if you are serious about recovery. And the reality is there is not one way to recover from an addiction. If you have tried a program or if you find that the mandates of another program do not resonate with you, that does not mean that you are hopeless. It just means that the program does not fit with your lifestyle or your values. Some people do not like the wording of AA, and other people may find it difficult to imagine being away for 30 days or more. Luckily, we are in an age where there are many programs available, both inpatient and outpatient. Some programs will use AA modalities, and others might use other programs like Smart Recovery or mindfulness. It's important for you to find the program that's going to fit best for you. If you are struggling with an addiction, you can discuss with a professional what your concerns are and what you need to be able to work through it effectively, and they should be able to refer you on to the appropriate person or tell you how they'd be able to work with you based on your needs. The only time you may want to look at an inpatient program would be if you are needing support to medically detox. You should always discuss with your doctor prior to starting any program, cutting back or abstaining, to ensure that your body is physically able to support the withdrawal symptoms without medical intervention. Finally, myth number 3, and I think this is the most important one, is that you need to quit drinking before you can begin any treatment program. And the reality is that doesn't necessarily have to be true. I recently attended a conference about modern approaches to addiction, and Dr. Lance Dotis pointed out that you would not expect somebody who is struggling with depression to no longer be depressed before they sought out treatment. So the same is true with somebody who is struggling with an addiction. It's not mandatory for them to have their addiction under control before they are able to get support. Thus, effective counseling will explore your reasons for using, even if you've not been able to maintain abstinence. You can discuss with your therapist whether your approach would be best using an abstinence-based approach, or if you have more success with a harm-based approach, which may look like cutting back or spacing out usage, or even things like methadone treatment. Just like the above point with the previous myth about inpatient programs, there's not one way to move towards recovery. So an effective plan will look at your individualized needs to figure out what will work best with your circumstances and your history. After all, we all come to our addictions from different perspectives, from different backgrounds. So why is there only one treatment approach? There isn't. So I hope that helped you to understand some of the myths about addiction and give you some more clarity on what's going to be most effective for you on your journey, or if you are supporting a loved one who is struggling with addiction. If you need additional support, please feel free to send me an email or book a 15-minute consult. Thanks.